Hi, my name is Dr. Ron Peek. I'm a chiropractor in Mount Laurel, New Jersey. Today I want to talk to you about carpal tunnel syndrome. Carpal tunnel is it's an increasingly common problem in our society today. You know, we have increased use of computers, increased time on computers, etc. And the resultant use of our wrist and our hands has really contributed to an explosion of carpal tunnel difficulties. Actually, almost any form of hand or forearm or wrist problem is labeled carpal tunnel syndrome, although accurately the carpal tunnel is in the wrist itself. But my own experience with carpal tunnel, and we deal with a lot of that in our office, my experience is that the impingement in the carpal tunnel is the least common area of irritation to the nerve that's involved. Now, the nerve that's involved in carpal tunnel, or the majority of wrist, hand, arm problems, is called the median nerve. The median nerve exits from the neck by passing through the vertebrae, and it comes down the arm, the forearm, the wrist, and into the hand. And there are several areas along that pathway that can be irritated and interfered with. In the neck itself, the nerve exits the spine by passing through movable vertebrae, movable spinal bones. That is the only place in the body where the median nerve must pass through movable bones. So consequently, logically, it's the most common cause or the common area of irritation and inflammation. That's my experience. Then it passes into the arm, into the elbow, into the wrist. The wrist, again, from our experience in our office, is really the least common area of impingement or irritation to the median nerve. That's one reason I feel that so many wrist surgeries are really not very effective. I don't think they're getting to the cause of the problem. So in a carpal tunnel situation, then you may have an impingement or inflammation, certainly at the wrist, at the elbow, and or at the neck itself. Now, in our office, what we do is we do an examination that focuses on the neck primarily to see if the misalignments are present there. And in addition to working to realign any segments that are impinging the median nerve, we give some rehabilitative stretching exercises for the wrist and forearm area, which is a good combination. If the main cause of the problem in a carpal tunnel situation is the impingement in the neck, then the only way to truly clarify it is to realign or reposition those vertebrae. In our office, we don't do physical manipulation. We don't do any twisting or uncomfortable posturing or positions of that nature with our patients. Instead, when we make a correction in the spine, we use a small handheld instrument called the impulse. And the impulse delivers a very high-speed, repetitious tapping to the area. And that high-speed, repetitious tapping can be utilized locally to help reposition and realign the misaligned segments in the neck. It can be used on some of the muscle tissue and the support tissue to reduce inflammation and swelling, etc. It's a very, very comfortable procedure for patients and for the doctor. It's very safe, and most importantly, it's very effective. So if you or someone you know is having difficulty with carpal tunnel or a problem with their hand, their wrist, their forearm, their arm, etc., call a chiropractic office. I think you'll be happy with what can be done from a chiropractic standpoint. And of course, if you're in our area, you can call our office. You can reach us at 856-778-8653. Call our office and ask for an evaluation. We'd like to have you come in and see if if we can help you. Incidentally, if you mention that you've seen this video, we'll offer you a special savings on the initial examination. Procedure in our offices: when you come in, we'll do an examination, including a graph of your spine and potentially some x-rays, and then we'll sit down with you and let you know what we found. If we don't feel it's a chiropractic problem, we'll tell you that. And if we feel we can help you, we're certainly going to tell you that too. We'll lay out a plan of action, and if you feel comfortable with what we've explained, then we take off together and see if we can avoid surgery and drugs in your situation. So I hope you've learned a little bit about carpal tunnel with this video. I hope you have a little better understanding of problems, and if there's something we can do to help you, please don't hesitate to give our office a call. Again, the number is 856-778-8653. Thank you very much, and we hope to see you in our next video.